Good morning, everybody. Thanks for joining us for this special COVID-19 briefing from City Hall. It has been from ABNY, and thank you to our guests from City Hall and the Mayor's office. Look, it's been a complicated few weeks for us, and obviously everybody knows the numbers are going up in our city and our state, and we just closed our public schools. I'll say at the same time, we are not without good news. The vaccine news was huge. Got 2 vaccines with over 95% efficacy, and that is a light at the end of the tunnel. And second, good news is we as New Yorkers have flattened the curve before. Like, our behavior has changed things, and that is an incredibly powerful tool to know at this time. So as we come upon Thanksgiving, I know, by the way, you can see airline flights, airlines are selling more tickets. People are going places. Please stay outside for Thanksgiving. I want to say that. I want to be really clear, like, we can control our future to some extent, and that is through our behavior. But I will leave that to the healthcare professionals and others to say more precisely. So we're really excited to be joined by Dr. Jay Varma, Senior Advisor for Public Health for the Mayor's Office, Jackie Bray, Deputy Executive Director for New York City's Test and Trace Corps, and longtime ABNY friend James Patchett, the head of EDC. These are incredibly well-known people to us. Dr. Varma is a renowned physician and epidemiologist with more than 20 years of experience, who recently came on to lead this for the mayor as a senior advisor. Jackie, who has been the deputy director of New York Test and Trace since it was created in May in response to the pandemic. I want to thank all of you. I want to thank James for his leadership in EDC. I'll say one last thing. If you guys have questions for later, please put them in the chat. And we've already gotten a bunch, but now I'm going to throw it over to James. Zoom to you.
Thanks, Stephen. Good morning, everyone. We appreciate you taking the time this morning. My only role in this is to say that you have really great health experts on the phone, and to tell you that from my perspective, and I know an interest of many of yours, is about the future of the economy. And I will tell you, I think in this case, the future of our economy is really dependent on our health. And so to the extent that we can collectively work to control the spread of COVID, it's going to ensure that we're able to keep going and keep our economy strong throughout this really challenging period. So I think you'll have a lot of information today to hear from Dr. Varma and Jackie. And so I'm going to turn it over to them. Obviously, we'll take questions at the end. Jay, do you want to go ahead?
Yeah, great. No, thank you all very much for having us this morning. We really appreciate it. What we wanted to do for this morning is to give you an update, a little snapshot of where we're at in New York City as it relates to the COVID epidemic, and then obviously spend as much time as possible trying to discuss what the implications are for all of you and for all your businesses and your families as well, because we realize what a challenging and difficult time it is. So we start all of our discussions by really highlighting the fact that everything we do is grounded in data. Now, I will also, put a caveat to that, which is that none of our data sources are perfect. All of them have, strengths and weaknesses to them. So what we do is we often take a number of different statistics and merge them together to try to make a decision informed by the data, while recognizing, of course, the strengths and weaknesses. So what you see here is one of the most sort of standard images that we use when we're discussing any health condition. This basically on the Y, or the vertical axis, is showing you the number of cases in the city, and the x-axis, the line horizontally on the bottom, is showing you the date. And what you can see very clearly is, particularly when you use what we call a 7-day average, which is a way to kind of smooth out fluctuations that occur from day-to-day reporting, is that as we all know, we had this very horrific and lethal epidemic from March through the end of May. But through the work of so many, courageous New Yorkers to basically adhere to these incredibly strict precautions about staying at home and wearing a mask and staying away from loved ones, we were able to really drive infections down. And what you see that's also equally impressive is the work that Jackie's team leads, which is our Test and Trace Corps. Because when you layer together the use of masks, the maintaining of physical distance, the good practices on hand hygiene, you layer that in with an extensive program to find as many people who are infectious through testing, and then to support them with either isolation or quarantine if they're a close contact, you can maintain very low levels of transmission. And New York City really made a tremendous mark by doing this. Now, of course, we all knew that the winter would be more difficult. As the weather gets colder, people both get fatigued from maintaining all these measures. And they also, there are changes that occur due to the climate. People move indoors, there are changes in humidity, which can affect the virus. And so what we're seeing now in the US and Canada and all of Europe are increases over time. And so that's what you see here all the way to the left and what you're experiencing right now. Next slide. Another way of looking at this is to also look at the, so in addition to the sort of more recent snapshot where you see, cases have increased, they started increasing in September. We were able to flatten them in October with a number of initiatives that were made, particularly in Southern Brooklyn and in parts of Queens, and then this more rapid increase. We can also visualize, if you look on the right side of the screen, we can also visualize another way to look at this data. And this gets to the issue I was describing before about multiple different data sources. So when you look at the right, we also look at another measure, which is what we call test positivity. So what this is the denominator, the number on the bottom of an equation is basically all of the people that got a diagnostic test for COVID-19 in New York City. The number on the top is the percentage of those people that had a positive test. And we like to use that number also when we're comparing different geographic areas, because it gives us an idea of something we call prevalence, which is that if you looked at the total number of people who are actively infectious at any given time, this gives you a good way to measure that. And what you see is that there are certain areas of the city that have had very high test positivity. But when you look now at the way this map looks now and you compare it to the way it looks before, all parts of the city now are increasingly affected. Really, we need to try to initiate new measures to drive our disease transmission down, which will be reflected in both a reduction in the number of cases, as well as what we call the test positivity. Next slide.
Jay, I just want to say that this sort of downturn at the very end is not an actual downturn. We sometimes get that question. This is incomplete data for the last couple days. So anything in the grayed out bars is incomplete. We shouldn't read that as a downturn. And I did just want to highlight something that Jay said. This area that I circled in purple here, this first increase was those 4 big clusters we saw primarily across Brooklyn and Queens, South Brooklyn, Williamsburg, Kew Gardens, and Far Rockaway. And between all of the work that the city did around testing and tracing, but also some of the rollbacks that the governor and the mayor did together, we did flatten that curve yet again, just this fall. You don't have to go all the way back to April and May to see that. And then obviously what Jay is talking about was this sort of citywide increase, but that's what you see there in the data.
So now we look at what is the entry point for how we can control this disease best. And it gets back to what I had mentioned was really one of the most important successes, starting from the beginning of June and onward, which is that testing is really the entry point for a lot of the major control measures. The first control measure, as I'll keep repeating, is wearing masks, maintaining physical distance, washing your hands regularly. Those are the first lines of defense. The second line of defense is what we have here, which is testing and tracing. And what you see here over time is that the average number of tests that are performed has been increasing. And we at the city have made a really concerted effort to try to build up the supply of testing. And actually, one of the challenges that we face right now is what you see here in the headline. We actually have the supply to do testing. We can do, on average, as it relates to laboratory capacity, we have somewhere between 70 to 80,000 tests we can do. And if stretched, we could do as many as 100,000 tests a day. But in fact, our efforts to sort of mobilize New Yorkers to come out and get tested has been challenging. We do everything we can, and Jackie can talk about the details about how we mobilize and move testing resources to get them to where people are. But really, one of the ways that we can really help drive down this disease is by really trying to match our demand to the supply that we have right now.
And to be even more specific there, I should say this slide's a little old. In the last week, New York did hit over 55,000 tests every day for our weekdays, and that's great progress, and we're really happy to see that. We could be testing 80,000, maybe 90,000 New Yorkers a day without yet adding new test resources, without adding new lab capacity, without adding new specimen collection capacity. And that's really our goal. So we saw a significant jump in the last 2 weeks. We now think we're probably consistently over 50,000. Certainly this past week, every day over 60,000. But we want to be in that 80, 90,000 range as fast as we can. And we could be there tomorrow. We need more people seeking testing.
Great. And then I think related to this, as I was discussing about,
oops, sorry.
Oh, again, we're covering hospital capacity. Okay.
I'm going back. That's okay. There you go.
All right. Yeah. So, I mean, I think one of the big challenges that everybody knows about, and really one of the reasons I would say that that demand, slipped a fair amount during parts of the summer, in addition to the fact that people feel well and they don't want to, don't feel the need to get tested, is we had a challenge with testing turnaround times during that time. What happened, just so people understand the story very well, is that we built up a lot of capacity with our commercial laboratories between April and May and June. But then there was a huge rush, as we know, on testing demand from all over the country, from other parts of the country that hadn't been affected. And our reliance on large commercial laboratories really hurt us and changed and really made our testing turnaround times get worse. This slide, just so you think about it, is basically anything that is higher up is good. So what you see here is that, we want test results, in the ideal world, we all want them within a day. Sort of the acceptable range is within 2 days. And that acceptable range was great during May and June. We were at over 75% of tests were coming back within 2 days. Then it dropped during these summer months, and through an incredible collaboration really between academia, government, and the private sector, spearheaded by James's team at EDC, we were able to launch and build a new laboratory that serves New Yorkers only. Priority is for New Yorkers and has tremendous capacity. And what you see now in the more recent months is that the turnaround time is returning back to the levels that it was in May, where the majority of results are coming back within 2 days. And in fact, if you subset that data and you take away the commercial laboratories, you look at just all the tests that are done by their public hospital sites, by all the teams that Jackie's team sends out, I think it's something like over 85 or something % of the tests are all coming back within 2 days, with the vast majority even within 1 day. Great, next slide. So I think one of the major challenges, of course, with this disease is we control infections really for two main reasons. One reason we want to drive infections down is we don't want people sick. People who are sick are going to suffer harms themselves. And we know, especially when you're talking, with people who are running, businesses and large organizations, people who are sick cannot be productive. And not only that, when people are coming to work or are absent from work because they're sick, another set of employees also doesn't want to come to work because they're afraid of getting sick. So that's one major reason, of course, to drive infections down, is to keep people healthy and, of course, to keep our economy going. The other reason, though, of course, that we need to prevent infections is that a subset of people who develop this infection develop severe illness and need to be hospitalized. And when you have even a small percentage of your population, 1 or 2% of them infected at any given time, that can present an enormous rush on our healthcare system. And of course, we need to have our healthcare system available not just to treat this disease, but to treat people who have car accidents, heart attacks, people who have strokes. So what you've seen over time here is that the number of hospitalizations has gone up, but it has not increased as dramatically as the increase in our case numbers. And what you see is that in terms of daily hospitalizations, we're somewhere in the range of 60 to 80 hospitalizations per day, which is well below where we were when we were at our peak, where we were having 700, 800 hospitalizations a day. And we feel very strongly that if we can keep hospitalizations low, generally to lower than 200 per day, our hospital system can continue to thrive and be able to also provide all the other services it needs to. So we get asked all the time about where transmission is occurring, and we can answer some questions before about what we're learning specifically from our data. But really, what we know from our data matches what you see everywhere else in the United States and everywhere else around the world. The most high-risk places are anywhere that people are indoors without a mask. So I just want to really emphasize that for us. Indoors without a mask is incredibly high risk for this infection. That risk then gets amplified when you have a number of different people in that place. So a place that's closed, where people are not wearing face coverings, and that is crowded is incredibly high risk. And that is the reason we continuously message to people, whether you're in a work setting, whether you're in a social gathering, whether you're in any type of event that's indoors, people need to be wearing a mask, and you need to decompress the number of people in there as well. So people not wearing masks, we all know that distance is additive and beneficial. So each of these layers, again, I'll keep emphasizing, is imperfect, but when they're layered together, they're very good. So the safest thing to do, like for example, when I'm here at City Hall and meeting people, is I wear a mask and we stand 6 feet apart. And the final point on this slide is also that the other way in which infection we know can be increased is when people are using their voice in any capacity, and particularly when they're using it for singing or speaking loudly, that the amount of transmission of this virus can increase.
And I think, because I know we're going to get further questions on this, maybe take a minute to talk about some of the specifics we have through our tracing program. So we know that of the cases we have who know how they got it, over half of them know they got it in their own household. And so part of what we're seeing, particularly in this second wave, is absolutely what Jay said: indoors, maskless. But because of this fatigue, people are starting to gather more at home. They're inviting their parents over or their best friend over. It's not a large gathering, but it's a dinner party. It's a game night. It's a backyard barbecue that ends up in the living room. And we're starting to really see that as a significant source of transmission, sort of spread and household spread to to sort of an extended family, which is one of the reasons we're frankly frightened about Thanksgiving.
All right, so let's go through the things that the city is doing, and then we'll talk a little bit about things that all of you can help us with, and then we'll close and leave lots of time for questions. So we've been obviously working as much as possible to issue guidance. Guidance that not just goes to the general public, but goes to different businesses, different settings that are important. This is supplemental, of course, to what New York State does, and you can find a lot of this guidance. You can find all of this guidance on the New York City Health Department website. As we discussed before, we're doing an enormous effort to really get testing available to people where they can really bump into it at any given time. Most of our efforts in the past 2 months have been focused on geographic targeting because we have been trying to sort of keep the city as a whole functioning while focusing geographically. And as I've mentioned already, we've done a tremendous amount of work in collaboration with EDC and private partners to reduce turnaround time and increase access to testing. We're also working on trying to get other types of tests. People have heard about antigen or rapid tests available to people where they can use them in different types of settings. And of course, many of you know also about our school-based testing efforts. As I mentioned, this is all focused primarily in geographic areas. And really what we've been doing is also trying to make sure that the data that you're seeing, the data that we see internally to make decisions is available to all of you. So making upgrades to the to websites. You'll see at the health department website is probably the best portal to start with. But in addition to that, there are links directly to the test and trace score program that Jackie runs, where you can see all of the data about how our contact tracing program is running. You can also have links there to our testing programs in schools. And really we're continuously looking for new ways to present that information to make it useful to people because we know how important it is. And then maybe Jackie, you can talk a little bit about the test and trace score hotline.
Yeah, sure. And this is really sort of represents the work we're doing tracing folks too, right? So we not only have this massive testing infrastructure, but we also have a really robust tracing team. We've got over 3,900 people all day, every day, who are making contact with cases and close contacts. We reach over 90% of all cases in New York City. We complete intake with about 75% of our cases. We're doing both notifications for close contacts. So me to my wife, say, but also facilities. We're calling any facility that any of our cases say that they spent time indoors. They'll get a call. We do over 100 facility notifications a day. So it's really a robust effort to interrupt chains of transmission. In terms of the hotline, that's a one-stop shop. Any question you have, whether you're trying to access resources for safe isolation and separation, which I'm sure we'll talk about in this hour, if you're trying to find a testing site closest to you, if you need to report a case as an employer, you are legally obligated to report cases of your employees that you know about. If you have people that need connection to primary care, that is a one-stop shop hotline that's available to all New Yorkers. This is a little bit more about our tracing program. We get some questions. Well, when will your tracing program stop being effective? You know, if it grows so big. The truth is, here in New York City, we've made a commitment. We're never going to stop test and trace. We're going to keep it going as long as this epidemic exists. And tracing is always effective. It does not have to hit 100%. In large public health deployments, you're not looking for 100%. You're looking for good enough to bend the curve, good enough to stop enough transmission to give all of the other measures you have going on a fighting chance. So like I said, we reach about 90% of our cases. We reach over 80% within the first 48 hours, and we complete intake on about 75% of our cases, which means they go through the entire process with us. We ask them about close contacts, about facilities they've been to, travel they've had, some of their behavior, their employment, what sector they're working in, how they get to work, all of that stuff. And then they start daily monitoring with us. We have seen an increase in symptomatic contacts. So if my wife, say, has COVID, I am a close contact. If I develop symptoms, we immediately assume that I'm a case. We no longer treat me as a contact. We now treat me as a probable case. And we've seen that increase. And one of the really important things about contact tracing is you find those symptomatic contacts and you find them really early because they're already in quarantine. They're already being monitored by us daily. Then we can both get them the services they need, make sure they're connected to they need, but it also means that we interrupted that chain of transmission. Back to you, Jay.
Yep. Okay. So now I think we get to the kind of the key things, how you guys can help us as well too. I think, I want to highlight here a couple of really important things. We really need to get the message out about the COVID situation in New York. I think a lot of us maybe, in our own little homes, because this is the type of work we do, we and our friends and family kind of know about this, but we also have to remember the vast majority of people have, been able to function over the past couple of months, not really worried about this being as much of a daily threat, but it really is increasing dramatically. So we really need your help to help us raise this alarm. We want to encourage people to limit their travel, to limit the amount of gatherings that they have for the holidays. If they want to meet other people, try to meet outdoors, bundle up and try to go and meet in the park, meet somewhere where we know that transmission is less likely to occur. And if you're having a gathering for the holidays, really try to keep it limited to your close family members, people you're in contact with on a daily basis already. We absolutely want to encourage people to get testing, whether or not they feel sick. One of the really challenging parts of this infection is the fact that a fairly large percentage of people, anywhere from 20 to 50% of people who are infected, may not feel symptoms. They may not have symptoms, or their symptoms may be so mild as they don't perceive themselves as being at risk. But at the same time, they can also transmit infection and cause infections. So we want people to get tested, and we have services available everywhere that they can find on that testing link. As Jackie has mentioned, one of the critical components of our testing and tracing program has building services, because we know how hard it is for people to have to isolate or to quarantine. So we have services, including hotels, that people can access free of charge, where they can safely separate and make sure that they are able to get the services they need while reducing the risk that they would transmit to their loved ones. And then, of course, really hammering home to your employees and to your colleagues, all about the importance of wearing masks and really setting up strict policies to monitor adherence. It's important for us to be, tracking our own adherence as well as those of the people that work with us. Between now and the holidays, we know this is an important time. Holiday parties are a tradition for everybody, office parties, parties with our friends. But this is just, unfortunately, not a good time to do that. It's perfectly acceptable for you to gather in some capacity, but we need to keep it small. We need to keep it, with people with their masks on, and people need to be 6 feet away. But anytime you increase those numbers, people are going to let their guard down. They're going to pull their mask off. They're going to do things. So your gatherings really should be limited to family members or to any situation where you can keep people outdoors, but also by maintaining that distance and wearing your masks. We obviously want to encourage the use of paid sick leave. One of the real challenges with this infection is that people will come back to work before they should because they need to get paid. So it's really, really important that we have that in place. Flu, this is also the time when flu season happens. One of the things that we've known from other parts of the world is that the measures we use to prevent COVID, masks, distance, hand washing, can also reduce flu. But we have a vaccine available right now, the flu vaccine, that can really drive numbers down as well too and prevent people from getting sick and prevent them from needing to use the hospitals, which we need to keep as open as possible. So we really want people to get their flu shot. And what we've seen so far is that I think over 1 million more New Yorkers, and maybe even more than that right now, have gotten a flu vaccine by this date than got it a year ago. So we know that New Yorkers are getting the message, but we still want to get that message out further. And then, of course, also emphasizing, again, the importance and requirements for reopening, including the importance of reporting cases to the health department.
I want to linger here for a second because this encouraged paid sick leave is new in our messaging, and it is driven by the fact that they went to work after a COVID positive test, that they even went to work symptomatic. That is not because New Yorkers are trying to put each other in danger at all. It is because they need to keep their jobs. And there's a amount of economic and behavior that's really contrary to public health. That's not the there. There's too many people go to work to really encourage from employees the use of paid sick leave for contractors that might work for you. There is the state paid sick leave program. My team has 300 people who on
Jackie,
call to take calls. Mm-hmm.
Jackie, your connection isn't very good. Let's switch back to Jay.
Oh, we'll go back. Okay.
Great. Well, I think we can move on. I think the next slide is just the closing, right? I don't think we have anything more we wanted to, and maybe it's time to ask questions. I think we can highlight these points there. Great. So back to you.
Perfect. Thank you both. First I want to remind everybody, please put your questions in the Q&A box so we can get them. We've got some, but we have room for more. Can I ask if I could start on the schools? Have you set parameters for reopening the schools, either numbers we have to hit or something else?
Yeah, no. So thank you for that question. It's actually something that we're literally working on right now. The mayor, felt strongly that he had to live up to his word, which was that, we set an agreement for what we would make a decision for closing our schools, and felt strongly he needed to stay to that. At the same time, when we originally made that agreement, there were things that we didn't know. We didn't know the experience from the rest of the countries in Europe, which have now shown that they were able to maintain their schools open. And we didn't have our own data, which we have right now, which shows that when we layer on all these interventions together, the rate of infection in the school community is lower than what it is if you're basically on the streets of New York. So what we're working on right now is that we also, just to add to that though, as the infection rate rises in the community, however, it's also important to understand that does represent a disruption to our public schools because we have such very careful triggers about when we quarantine classrooms and when we close down buildings. So what we're working on right now very actively, and the mayor is hoping to have us announce within a few days, before the Thanksgiving break, a plan for reopening and what levels of schooling, and it may involve additional testing and other thresholds.
Thank you. Someone asked the question, are certain kinds of testing more accurate than others? Do you want to push people towards whether it's rapid testing or PCRs, or like how should we think about that?
Yeah, so it's a very important question because, and it's one that we are still learning about, but the way to think about it is this, that the single most important thing is to get tested, period. That's the one thing. The second most important thing is to not get tested and think just because it's negative, I'm safe. Okay, so I want to always sort of emphasize those messages. Get tested, but it's not I can do whatever the hell I want thing. So those are the first two most important messages. Now, the next question becomes like, what test should I use? So almost all of the tests that we use involve a sample from the nose. There are also tests that you can do that involve saliva. Most of the tests that involve a sample from the nose are testing for like the fragments of the virus, like the genetic code, what we call the DNA or RNA. And we call those PCR or polymerase chain reaction tests. Those are considered the gold standard. And the reason they're the gold standard is because that's originally how this virus is detected. It's how we confirm that anybody has a viral infection. There is another set of tests called point of care or rapid tests. Now, what's confusing is that some of those rapid tests are also PCR tests, but many of them are something that we call antigen tests. So an antigen test isn't looking at the genetic code of the virus. It's basically looking at like, what does the virus look like? The virus has a big spike on the front of it and it's trying to detect to that. So the ones that are called antigen tests are very good at identifying people who are very infectious, but they don't necessarily pick up people who may have milder levels of virus in their body. We're still trying to understand what the implications of that are. There is a school of thought which says that if you just focus on antigen testing, that's important because what we really care about are people that have high levels of the virus that'll transmit to others. But if you're mildly sick and you only have a mild level of virus, you still don't want to get missed. So that's a long way of basically sort of reemphasizing, we want people to get tested. A negative test doesn't mean you can not wear a mask or not maintain distance. You still need to do those. And number three, the most important test is really kind of the one that you get. And so if it's a rapid test, just understand the limitations of it. But really, it's most important to just get any type of testing done.
Thank you. Jackie, you mentioned that 50% of the people think they get the virus at home. Someone has put up the question, do we know where the other 50% of people think they get it, and is there some degree of accuracy for that?
So I hope I'm back. I hope you can hear me. About 50% of our cases got it. We have a sense of where they got it. Of that group, half know they got it in their home. The others are travel and either work or social gathering.
Okay, thank you. Can I ask, hey, James, if we have increased need for PPE, one is it back to the way it was, whether it's on ventilators or other PPE, and are we prepared for what's ahead?
We have. Oh, sorry, James, go for it.
No, go ahead. Sorry. I mean, we have, so we're put in place an order asking all of the hospitals to have a minimum of 3 months capacity at surge levels, which is the levels we were experiencing in April and May. So at the current levels that we have, 3 months of capacity at that level of cases means that we have, 6 to a year worth of current storage at easily. So we're in very good shape on a PPE basis. And of course, we still built up a significant amount of local capacity to produce local PPE supplies. This was an effort that Jackie and I worked on very closely together. And so it puts us in a position where we also have the ability to turn back on local production if we ever get to a place where we have these challenges again.
Thank you. Can I ask maybe Dr. Varma, how do you see the next few months? Like, what's the potential arc of our lives here on like a if we all kind of adhere versus if we don't adhere to the guidelines you're talking about?
This is, so I'll tell you that the mayor refers to me and some of my colleagues as Dr. Death and Dr. Doom, because, our job is to sort of envision, worst case scenarios. But at the same time, we're also humans. I have a wife and 3 kids, and, we also want to look at the world in a happy way. So I'll try to keep it brief, but let me give you a couple of scenarios. One scenario is the city continues to do the way it's doing right now and doesn't impose any additional restrictions on society. What we envision happening is, and we have statistical models that we've run repeatedly and spent all of last weekend, we're working and revising again, that show that we will have another very severe peak of this disease, which could potentially result in thousands of people dying. That peak of the disease would not be as severe as the one we had in March and April. And that would be because we have some percentage of the population that has some form of immunity acquired from prior infection. We have a massive testing and tracing program, which we didn't have before. And we also have a lot more people wearing masks and doing gatherings. So we would continue to have a lot of illness and death, but it wouldn't be as severe as before. Now, of course, that's not really acceptable to us as policymakers. There is a trade-off, of course. We're not going to shut down the city to save maybe one life, but we probably need to think about doing it to save hundreds of lives. So the second scenario is a form of milder restrictions. And that's really the kind of the back and forth we've been having with the state right now, where the mayor has made the case to the governor that we need to roll back some of our higher risk activities. Because we have shown that we can blunt that rise. We may not be able to drive it back down the way we did in March and April, but we can allow people to have a version of life that they're willing to sustain, because we have to factor in group psychology and how people feel, as well as blunting the rise so that we can maintain our healthcare system and reduce the number of deaths and infections. So that's the other thing. And then the more extreme scenario would be going back fully to a pause. And that would be, without question, the single most effective way to drive infection rates really down, but also comes obviously to tremendous cost to businesses and social life. Now, if I had to predict, the most likely scenario is that we will have to, first of all, impose those sort of rollback restrictions first. And it may happen that we have to go to a pause. The mayor and governor have not said that publicly because we don't know when that might happen. My fear is that it might, but other things happen in between. There may be changes if the city, if the situation around the country improves, or other scenarios in which you could imagine that we didn't have to go fully back to pause.
And Jay, it's fair to say that what happens over the holidays is a really critical factor in this. So individuals' behavior during Thanksgiving and Hanukkah and Christmas really significantly inputs in the overall trajectory of the cases, right?
Yeah, no, James, you're absolutely right. Yeah, so to emphasize, this is why those interventions we keep talking, those personal measures we keep talking about, wearing a mask, limiting gatherings, are so important. The experience from Canada, if you look back at Canadian Thanksgiving, is that you see this enormous spike in infections about 7 to 14 days after their gatherings. We also saw this on a smaller scale in September. A lot of the communities that were affected most markedly in southern Brooklyn were Orthodox Jewish communities, where there were a lot of gatherings around the 2 very high holy holidays. And we see very clear spikes about 7 to 14 days right after each of those. So that is and so there's a lot of uncertainty about it. I'll just close by mentioning that the vaccine news is incredibly promising. I am not somebody that gets excited easily about biomedical interventions, as James and Jackie knows. I would say that I am cautiously excited, but the challenge is supply. And I don't think there's any likelihood that supply will be widely available to people probably until, say, maybe March or April, although there's still some uncertainty about that. I don't know, Jackie or Jeff or James, do you want to add anything?
I think you covered a lot of it. I would just say that we know as New Yorkers how to control this virus, and now we've got to double down and do it. And that's about all the stuff we've been talking about. It's about not gathering with our families over the holidays and all of that stuff. It's about not traveling. It's about mask wearing. It's about avoiding indoor gathering.
Thank you. As long as you mentioned vaccine, how do you how do you look at distribution when it's time, and can I ask how you consider certain communities that maybe are reticent because for historical reasons and others about a vaccine?
Yeah, no, thank you for that question. I think it's really important. So I think, I would say one of the challenge here, of course, is this uncertainty. Like which vaccines are going to become available first? And each of them has very different handling methods. People have probably read the news about the Pfizer vaccine and the Moderna vaccine, both of which use very similar technology and remarkably and importantly show very similar results as well. They require special handling, and we have done extensive work really since, I would say, June, working on trying to develop distribution sites that build on the immunization program in the city, which is really one of the most successful in the country. So that's number one. Number two is you're absolutely correct that probably the biggest challenge here, once supply becomes secure, the biggest challenge is going to be actually getting people to accept vaccines. We think of vaccination populations as you have populations that are broadly accepting of vaccines, populations that are broadly hesitant, that are always a little cautious about it and maybe want to delay or wait and see. And then you have vaccine refusers. The challenge is that a lot of people who are vaccine acceptors have kind of drifted into these other communities. And there is a very real danger that we have about disinformation campaigns, as we've seen in our political life and everywhere else, really burgeoning and strengthening those communities and moving more and more people into the refusing community. So we have a lot of work that we're trying to do, but I think this is where the collaboration with all of you is going to be so important. Everybody is a vaccine messenger, whether it's to your friends and families or to your employees. So once we get more of this, I think we're going to be back with you many times again in the future, trying to look at ways that you can help us to really push vaccination, because that is going to be the way that we go back to maybe not a fully normal life, but a version of normalcy that we can all live with and feel comfortable with.
And part of the reason we were excited to talk with all of you is we know that trust in government is an all-time low. It breaks my good government heart to say that, but we know it's true. And so we need you as public health messengers. It is not your day job, but it now absolutely has to be your second job for all of us. People trust you. Many people trust you more than they trust us. So we need you to carry these messages.
Thank you.
There's a bunch of questions in the chat. Do you want us to try to answer those right now?
Yep, I got them, and I will put them to. But one thing I just want to say to sort of the ABNY community here, like, please use your social to amplify this. Like, even no matter how big you're following, please say, if you are like, I'm staying outside for Thanksgiving, you should do the same. I think that, those messages are really important from trusted sources. So please do. Dr. Varma, question in the chat is, are gatherings of 6 and 7-ish people okay? Like, is there a number at which it's okay that people should feel comfortable?
Yeah, and this is the challenging one. Okay, so first of all, it's not absolutely the number that matters. It's who you are normally with. So if your close network, and by close network, I mean the people who physically live in your household, and the people, if you've already created a bubble of some sort, people have said, okay, well, my household can mix with this household because our kids are always together anywhere. That is really the limit that we want to keep this at. It really should be restricted to an indoor gathering, should be restricted to the close friends and family who you see are in contact with every day, not casual contacts. One of the things I love about Thanksgiving, I think we all do, is like, oh, so-and-so can't be home with his family, just come on over and join our party. We just can't do that. It's going to be really problematic. So that's who you invite. And then how many you invite. Our broad public health guidance is, to limit gatherings to no more than 10. That number is kind of derived from science. It's based on the idea that when the infection rate in the community rises, if you took a random sample of, say, 10 people, you're more likely to have one of those people walk in and have undiagnosed infection. It's not exactly that high in our community right now. We've done a good job in New York. If you look at our curve and you compare it to population, we are like way better than 95% of the places in the country, but it still increases that risk. So we would say that keeping the gathering to your close friends and family is more important than the number. But if you had to pick a number, it's fewer than 10.
Thank you. someone asked a question about museums and how do you look at museums who spend a lot of time when they have a lot of space and spend a lot of time on safety? Do you see museums being up soon in the groups that you're talking about closing?
Yeah, this is going to be a decision ultimately made by the governor's office, and they're looking at a number of different frameworks. I'll just give you the pure public health answer. This is not a policy comment. From a pure public health perspective, how we prioritize things that we think need to be closed are, first of all, are these settings where people are indoors and unmasked? And that is why things like indoor dining and indoor group fitness, where it's really hard to keep a mask on and things like that, and bars in particular and clubs are such high-risk events. The next is, what are places where people, while they can be indoors and wear masks, may be gathering in ways that are potentially unhelpful? That is increasing their human contact and therefore increasing the likelihood that they could have an unmasked and close contact exposure. And that's, I think, among the range of places where museums and other facilities fall into. And so it is a bit of a gray area. And so I can't give you a recommendation that it's absolutely going to be closed. But in the governor's original framework, I think that was grouped in together with a lot of other indoor activities. I don't know whether from a policy level they'll make that decision this time.
Thank you. We have a question about universities. I'll take it in two pieces. One, have the universities been a real source of transmission, either by people traveling back and forth to their families? And second, do you have a plan when students are planning to come back for January to testing plan or some other ways to maintain safety?
Yeah. Jackie, do you want to answer that? Since you've been working
with sure.
Universities, yeah.
So yes, we have seen transmission at colleges and universities, although I will say the New York City colleges and universities are doing great. We see far less here. One of the reasons that's true is that they all have really good testing and contact tracing happening on site. If students have gone home for Thanksgiving, one, they should all be encouraged to get tested before they go home. They should be encouraged to be very careful and get tested after they've gotten home. So if you're a college and university, please be sending that message to your students. Two, if you plan to bring them back, I think the question was in January, and I think we think it's good that they're not coming back immediately after Thanksgiving. Yeah, we want to help you get everyone tested as they're coming back, and we want to help you meet the quarantine guidance for folks traveling back. So we're happy to work with you one-on-one. And hello to Marvin Krislov, who was a professor of mine decades ago.
Can I ask a question about transmission in terms of seems to be less about touching things. I guess the question I have is, are you guys nervous about kind of surfaces at this point in time? And how do you think about spaces where there isn't anyone, but obviously spaces that are used, and how one achieves protection in those spaces?
Yeah, and so I guess you're talking about things where like you're on a subway train, but there's nobody else on it. Are you still at risk? That type of thing. Yeah.
Yeah, or an elevator.
An elevator, exactly. Yeah. So an area of uncertainty, just to preface that, which kind of can say everything about our disease, about what we know about this disease. What we know right now is that the vast majority of infections occur from respiratory transmission, something coming out of your mouth or nose, and virus and flying into other people. This virus can absolutely live on surfaces, but what we have seen and with sort of the lived experience of around the world has been that surface level risk does not appear to be very high. Now, that could be because we have sent such strong messaging about hand washing and hand hygiene that behavior is enough. People are instinctively a little bit better at knowing that they've touched something and they need to wash their hands just because that messaging is so strong than they would be, say, about wearing a mask and maintaining 6 feet. So I would say that I can tell you my personal activity is that I am not concerned about touching surfaces, but I am also incredibly aggressive about washing my hands, and my hands are peeling as a result of it. So that's the way I look at it. So I don't think people should be paranoid about touching surfaces, but it's good to observe really good hand hygiene just in case.
Thank you. And again on subways, just as you mentioned, you brought them up.
Yeah, no. So what we found so far is that subways, can be very safe environments as long as people are wearing a mask, maintaining distance, and the MTA has done an incredible job of also increasing ventilation, which is another added layer of benefit and protection that you have. I would also just caution, however, of course, it's hard for us to identify transmission in the subway. It's a casual form of contact, and people are not going to, a lot of people can't remember where they might have gotten infected because they went to 5 different restaurants in the past 2 weeks and went to the gym and had 2 birthday parties and then took the subway at the same time. So there is a ascertainment challenge as well too.
Thank you. Is there still a need for people to donate, people with antibodies to donate plasma? And if so, is there a volunteer sign-up program with this?
Yeah, we still would recommend that people do that. I think the data on that is still a bit murky in terms of the magnitude of benefit. But there are a number of situations in which it is used as a potential adjunctive treatment. You know, the best option to be able to get access to is the one that, you know, the president had, which is synthetic antibodies. So not the plasma, which is antibodies from humans, but the ones that are engineered in a laboratory. And that's what we call monoclonal antibodies. But we know those are in relatively short supply. So we would still encourage New Yorkers, those who have tested antibody positive, to donate. And in addition to donating just for plasma, for this disease, it also benefits a number of other more uncommon conditions, but ones for which we also get shortages of plasma.
Thank you. Can I ask what you've seen in terms of long-term health impact for people who have recovered? Has that been a major concern and present problem?
Yeah, so this is one of those situations in which, because the immediate threat is so severe, there really hasn't been a tremendous amount of work to understand what the longer term complications are. But I can tell you among healthcare professionals, and then of course, obviously among people who survived this illness, this is a very real problem. The estimates are that anywhere from 25 to 35% of people who had an infection, even a relatively mild one, do report some lingering effects several months later. Some of those effects are mild, they're fatigue, or I don't quite have the stamina that I used to have. Some of them are severe. They can lead to mental health complications. They can lead to severe difficulties with daily activities. And so actually one of the things that's going to be sort of, I think, publicly announced very soon, but has been well understood, is that, you know, the city, along with a lot of other academic partners, are really trying to set up centers of excellence, places where we can help provide support to people over the long term to really try to understand this a lot better. Because I do think, unfortunately, you know, one of the things to keep in mind is this virus isn't going to go away. The most likely scenario is that even if we have a highly effective vaccine, it's going to continue to circulate in human populations. It's already been kind of introduced, and there's probably no real way to stuff it back into, you know, to eliminate it like we did with smallpox. And so understanding the long-term complications is important, not just for individuals' health, but also for us to be able to understand what the trade-offs are over time in terms of if we ever have to go back 2 years from now to a period when we have to do restrictions.
Thank you. We have time for one more question. I'll ask that. Somebody had asked, is there a way for businesses and organizations to have on-site testing or to more effectively become partners in testing for their staffs?
Jackie, do you want to take that one?
Yes. Yeah, yes, and the answer is yes. We have a new type of test site called a microsite or a self-swab site. We can give you a 90-minute training, your staff a 90-minute training. We hand you a set of take-home kits that you basically set up a folding table, do a 90-minute training, sign a short agreement, and we will give you the kits. And you're watching people self-swab themselves, and then you're responsible for putting them in the FedEx box. So yes, would love more partners. We can do hundreds of these sites across the city, and they're really effective. They've got a less than 48-hour turnaround. They're the PCR test, and it helps us really expand our reach as a test and trace team. So we will make sure that we send around after this to all the participants a link to sign up for one of those trainings and to become a partner with us to get testing on site.
Thank you. That would be terrific, because obviously we're going to be doing this for a while. Maybe we could set them up all over the city on Monday to help people with Thanksgiving, but that's a little fast. Okay. Any parting comments in the last minute or two we have, and advice for us as a community?
I would just say that, well, first of all, I want to thank you for including us in this, and we hope to continue these types of sessions and dialogue. It's important for us. Hopefully it's been helpful to you as well. And I just want to say it is going to be a challenging few months, and we get that because we are humans who have families and live lives as well too. But we want to be here to be supportive and provide the information and the resources that can help people through this challenging time.
Perfect. Look, I want to say thank you to the three of you for the incredible work you do for our city. It is so important. We're grateful. We know this feels at times like thankless work and always rolling a ball uphill, but we're really grateful. And I just want to close again by saying, I get into a fight with my mother all the time about why I'm not bringing my three kids to her home to see her. And it is unpleasant. And I love my mother, but I really don't want to give her COVID. My kids go to school. And so I know this is like dragged on for a long time. I really just want to encourage everybody, please, please, please take a walk. James, do you want to tell us what you're doing for Thanksgiving? You want to tell everybody what you're doing, since you told me what you're doing for Thanksgiving?
Yes, absolutely. We are going on a walk with my wife's brother and his wife, and then we are eating turkey sandwiches outside, or in my case, I guess tofurkey or something.
So I want to encourage everybody to follow James's example, and really thank you, the three of you, for what you do. We're really grateful. Have a good weekend. Everybody have a happy and distanced Thanksgiving.
Thank you.
Thank you.